Thank you, Leon. Hello, everyone. Today, I'll be spending the next few minutes telling you about a new treatment for preventing arthritis that we are developing in our lab. This athlete just ruptured her ACL. And just like 80% of people with such injuries, she will also develop arthritis within 8 to 10 years. And actually, such injuries are extremely common among young active people like those who run a lot, the dancers, and it's become an epidemic among the high school athletes. Interestingly, it's a huge problem in the horse racing industry, where these horses, because they're made to train so much, and because of the multiple injuries they get, they often get severe arthritis, and that results into shortening of their careers as well as their lifespans. So what happens is that a joint injury triggers a biological response, as a result of which this nice and healthy-looking cartilage begins to degenerate. And then over a period of time, it may start looking something like this. Now, this is when the patient starts experiencing arthritis symptoms, like the extreme pain and the inflammation. And also, this is the time when the doctor can diagnose arthritis by looking at an X-ray. The challenge is that by this time, it's often very late to repair any of the damage that you see here. And the only option patient is left with is to get a joint replacement because there are no effective treatments available. I'm sure all of us know people who suffer with this disease, so this is not a surprising number that there are hundreds of millions of people suffering with this disease, yet we do not have a cure for it. The current treatment options, they only provide a temporary pain and inflammation relief, but they do not treat the disease. But despite of that, it's a staggering figure that people spend over $7 billion every year on these medications. So the way we've approached this problem is to prevent arthritis even before it starts. We want to intervene right after a joint injury, and you can think of this sort of a vaccine that can be given to the patient right after an injury so that he does not develop arthritis. Now, this treatment comprises of a unique drug combination that we developed in our lab. It's an anti-catabolic agent, a drug that prevents further degradation of cartilage, and a pro-anabolic growth factor, a drug that helps the degraded cartilage to regrow back. Both these drugs are FDA approved for other purposes, so that is great. We've also engineered a nanoparticle-based delivery system that enables safe and targeted delivery of these potent drugs into cartilage. Now, it's important to keep in mind that cartilage is very different from most other tissues in our body. It is dense, it's negatively charged, and it does not have any blood vessels. So all these factors make delivery of these drugs into cartilage quite complicated. What we found was that the ideal drug carriers will have to be 7 to 10 nanometer in size, which is pretty tiny, with a strong positive charge. Now, since cartilage is the most negatively charged tissue in the body, it is a positive charge that enables rapid penetration and also retention of these drug carriers inside the tissue, creating a drug depot. We found that these properties are actually exhibited by this naturally occurring small protein called avidin, which is extracted from egg whites, and it worked out perfectly as a nanocarrier. So we've created these avidin-like structures and also encapsulated our anti-catabolic agent and tethered the growth factors on the surface of these proteins. So now let's see how the system works. So this is the joint of the athlete. She injures her ligament. Now she's in excruciating pain and her knee is very inflamed. So she goes to the doctor and she says, "Hey doctor, can you save my knees from getting arthritis?" The doctor says, "Yes. I'll give you a 1-dose injection of these positively charged nanoparticles, which will penetrate into the deep zones of your cartilage, sit there, and provide a sustained release of effective drugs." Now let's zoom into her cartilage, and now what we see here is these positively charged drug carriers, and these yellow circles are the tissue cells. We've designed the system such that these drug carriers can release a part of the drug within a few hours to provide an immediate pain and inflammation relief to the patient, followed by a slow release of the rest of the drug that happens over the next several weeks, and it provides small doses of drugs to the cells, which is extremely critical for preventing arthritis. So that said, this delivery system is something which can be used for delivering any type of drug to any type of tissue in the body which is negatively charged. So this delivery system has applications beyond just treating arthritis. We've tested this delivery system using rat models, and we found that indeed our nanocarrier was able to penetrate through different types of rat knee tissues, as you can tell from the red color of these images. We found similar results with rabbit models as we continue to test our system with larger animals. The image here at the bottom, the purple color, if you can see in the image, that shows that our nanocarrier was present even at 1 week inside the tissue. So that's promising. So what this means is that we have tested our nanocarrier using live animal models. So we've tested its penetration, its retention, and we know that the system works. Now what we are testing is the biological response of the drug carrier conjugate using rabbit arthritis models. But in the meantime, we've tested the biological response in vitro using cow cartilage. So what you see on the y-axis here is the GAG loss. Just remember that GAG is the good stuff inside the cartilage. So higher GAG loss means that the cartilage is getting degraded. So the blue line that you see here at the bottom, that's the rate of GAG loss in a normal cartilage. When we created an arthritic model, the GAG loss significantly increased, which is what you would expect, and that is the condition that you see inside the knee joint right after an injury. When we treated the arthritic cartilage, which is the red line there, with 1 dose of our drug, the GAG loss significantly reduced, which is good. But we realized that we needed multiple doses, focus on the black line, to keep the GAG loss levels closer to the normal levels. Now, this multiple dose condition is like giving multiple injections, giving injections of the same dose every day to the patient, which is a lot of drug and can cause a lot of systemic toxicity. So that's not the path we want to take. However, when we treated the arthritic cartilage with just 1 dose of our carrier drug conjugate, as you can see, we were not only able to replicate the multiple dose condition, but did better than that. So the message here is that with the technology we've created, we've made this 1 dose injection that can be given to the patient right after an injury as a precaution against developing arthritis. So of course, a lot more needs to be done. We are in the process of doing animal studies and hope to see similar results like we saw here. But I will leave you with this message and hope to continue our discussions later. Thank you.